plant flower exhibit. Alright,
Is that to celebrate how good we did on the exam?
no celebration here.
Oh.
I can't remember exactly what your class average was. Might have been a 74 class average.
That's lower.
My average is usually running in the mid-80s, so I was a little disappointed. Alright, so let's get signed in. Okay, Friday, you need to have, if you are a person who needs paper, you need to print off your lab values. Y'all know where your lab values are? In your module? Your Galen lab values. Also, make sure you bring this book with you Friday, because we're going to use it for the nutrition chapter. And there's a bunch of stuff in here too. You've got test taking strategies, chapter 4. There's a whole section on fundamentals, or foundation of care, that can be helpful. I think by the time you get in 170, you are expected to know all of the lab values on the sheets. That's the way it sounded so far. I've been orienting to it. And I actually give y'all a list of what to know in here, so I don't make you learn all of them. But I give you more than you need. You have to do that. Otherwise, I'm like, you have to know this, 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 right? I can't just give you what you need. I don't know if this is gonna work or not. So you know how I always complain I didn't sleep?
Got sleep tonight?
Melatonin, my new best friend.
I took it at 6:30 last night.
I could literally feel it within 20 minutes. I'm like, is that sleep that I feel? I got just a little bit excited. I said, no excitement. Don't undo the melatonin. The first good night of sleep I've had in probably 6 months. Yeah. Okay. This stuff is not turned on. The sign-in sheet should be going around. It's not stapled. So we're in chapter 16, health promotion. Are these chapters we cover in which way over? Y'all remember? Yay, nay? I can't remember. I think health and wellness is in there, but I can't remember what health promotion is. Health promotion is one of the, categories on the E-class. So chapter 16 starts on page 244. So when we think about what health promotion is, it's a way of thinking about well-being. Think about health promotion. The word promotion to start with. What does promote mean? To incorporate, to have, promote, to give. So when I think about health promotion, that's what I think about. As nurses, what can we do? We can promote health in a lot of different ways. So there's habits that are related to health promotion. Things like exercise, a healthy diet, plenty of rest and relaxation, not smoking. Now when it comes to smoking and drinking, is it legal to do both? Yes, it's legal to do both. But when they say about smoking, do they say you really should cut down on your smoking? Or do they say you should stop smoking? Stop. They say stop. Any amount of smoking is bad, okay? But when it comes to alcohol, a lot of times they'll say you can have have like one toddy a day, or you can have one beer a day. But you should not drink in excess. So they allow some drinking, but they allow no smoking when it comes to being healthy. So that's the difference in the two. So it says no smoking or consuming excess alcohol. So you see how one is not smoking, the other one is you need to avoid excess. And then just say no to drugs. No drug abuse, avoiding drugs and things like that. That promotes a healthy lifestyle. So we have this thing also called health protection or disease prevention. Health promotion and disease prevention are different. So you have to be careful of what you're talking about. Health promotion is that behavior that is motivated by a desire of well-being. Like, you want to look a certain way in a dress because you have a friend that's going to have a wedding next month. So you start doing these habits for that reason. It's what you're motivated to do. Just a potential, a human health potential, you want to act on that. Now, health protection or disease prevention is the behavior that's motivated by a desire to actively avoid an illness, or maybe detect it early, or maintain the function within an illness. Like, your parents may have had heart disease. So you're on a low-fat diet, you're exercising, you're doing that because you don't want the heart disease that your parents have. That would be health protection. It's the reason that you're motivated to do these things, whether it's health promotion or health protection. Questions? So it's not really apples to apples. Let's compare the difference. So I have a cute picture here. That's a cute picture, but here's another cute picture. Are you a runner? Well, if he's behind you, you are now. Some people run because they want to run, but other people run because they have to run. So a person may be on a healthy diet because they want to be on a healthy diet, and then because of their family history, they get diabetes, and now they feel like they have to stay on the healthy diet, they can't stray from it. So it's a difference in the motivation. So when I compare the two again, health promotion is not related to disease. It's not disease oriented. It's motivated by that personal approach to wellness, and the person's just trying to increase their positive outlook. Health protection is injury or illness specific. It's motivated by the avoidance of an illness, and they're trying to stop the potential for health occurrences of insults to their health and well-being, like a person who has arthritis or osteoporosis. There's certain things that they can do to prevent that disease from getting worse. So, health protection. Questions? Oh, it always starts here. Matching. Alright, let's view the pairs. We see that health protection or disease prevention would be walking 30 minutes a day, 5 days a week to prevent a heart attack. I had to use that particular numbers because that's the required amount of exercise. Health protection. Health promotion is exercise and look good in a bathing suit. Okay. Now, when we think about health, disease prevention, there are 3 levels of prevention. We have primary, we have secondary, and we have tertiary. Primary prevention focuses on health promotion. It tries to decrease the risk of exposure to disease, like teaching first graders how to wash their hands. That's a primary level of prevention. sending an elderly person to get their shingles vaccination is a primary level of prevention. I am focusing on health promotion. I'm trying to decrease the risk or exposure to disease. Immunizations is an example of that. Secondary prevention looks to identify things early, identify health problems early. How can I do that but with screening? Doing all kinds of screenings. Screening is secondary as an S. A mammogram. Teaching someone to do a breast examination, self-breast examination. Teaching a male to do a testicular examination every month. Because what they're doing is screening themselves to see if there's any issues, so they can find it early and do something else about it. And don't take me ugly, but if you got these, you got two of them, secondary. And if you got these, you got two of them, secondary. Just saying. So those exams are secondary. I can tell you right now, I know y'all get these mixed up, so you need to study, because you need to know the difference in primary, secondary, and tertiary. And you know, when you're teaching, like you have someone that's in their late 40s, one of the things you should do as a nurse is teach that person that by the time you're 50, and I think they're changing the age to 45, you need to have your first colonoscope, because they're at risk for having colon cancer. And a colonoscope is a type of screening that looks for that. Does that make sense? So people who are at risk get these screenings. Going to the doctor annually, getting your annual physical, is a type of secondary prevention. The doctor, the dentist, the eye doctor, all those that you have your annual visits are all secondary prevention. Going every 3 months to have your blood pressure checked, to monitor it, secondary. Having an assessment in the hospital, a nurse performing the assessment could do secondary prevention because they're screening, looking for things. Does that make sense? Tertiary focuses on the restoration or the rehabilitation of a person who has an illness and they're trying to return either to normal or increase their level of functioning. So I like to think about therapy and tertiary T&T. It could be physical therapy, occupational therapy, speech therapy. It could be rehab for drug abuse or alcohol abuse, rehabilitation. So it could be either, but it's tertiary is trying to focus on restoration. Questions? There's a couple of activities in the other modules. They're good because it's matching, but some of the answers I disagree with. So if there's something that you disagree with, you can let me know, because it hasn't been fixed yet. Your book goes in pretty good detail on these. So I made this triangle because I was trying to help students to understand and see it a different way. So I made like the Maslow's triangle. Primary prevention being the first one, so it's on the bottom. This is your well population. You know, we use the immunizations, we focus on health promotion, we assess for risk factors, meaning we can ask questions about family history and things like that. Assessing for risk factors is part of primary prevention. Secondary prevention are the people who are at risk of a health problem. They get the screenings because they're at risk. Maybe it's because of age or a family history. So in primary prevention, if I found out somebody's at risk, then we can go with the screenings with the secondary prevention. Tertiary prevention focuses on the people who actually have a health problem. And we're focusing on rehabilitation, preventing complications, and improving their quality of life. Let's climb early.